Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is radiofrequency ablation for back and neck pain treatment. Back pain affects 90% of Americans at some point in life. It's the second most common reason that people go to see a doctor, just behind the common cold. It's the leading cause of disability in those under the age of 45, and it's seen in up to 40% of those who undergo back surgery. They end up failing and get failed back surgery syndrome. Neck pain affects about 10% of the population at any point in time, up to 45% each year. 50 to 70% of individuals have neck or shoulder pain at least once in their lives. When you look at the back of the spine, you have these joints. They're about the size of a thumbnail on each side. They're called facet joints. Okay? Collectively, they provide a lot of motion for the spine, but they are prone to arthritis just like other joints, the hip or the knee. And 45% of the time, they're the cause of back pain. And there's no successful joint replacement for a facet joint like you have for the hip or the knee. To make the diagnosis of facet joint arthritis and then be possibly a candidate for radiofrequency ablation is not so easy. You have to listen to the patient. A physical examination can help as well. And then imaging studies like x-rays or a CAT scan can help show if there's facet joint arthritis, such as you see here. So this is a CAT scan. You see a vertebral body, spinal canal, and then you have a facet joint here. See how pristine that looks? There's no bony overgrowth. It's just a nice joint space, nice curved joint space here. But look how bad this looks. Overgrowth of bone, minimal joint space, okay? So this is considerable facet arthritis. Now what you could say is this person should be having a lot of back pain at this level, but unfortunately that's not always the case. It ends up almost being a coin toss sometimes, because you may have very little arthritis on x-ray and have huge back pain, or vice versa. Even the best trained spine doctors end up being wrong half of the time. So diagnostic injections to help diagnose the source of the pain. Medial branch blocks is when the pain doctor can put numbing medicine around the joints where these little tiny nerve endings are, called the medial branches. Okay, that can give great information if it provides pain relief. Or a facet joint injection where the needle actually goes into the joint, and numbing medicine and steroid. If that provides pain relief, you can also say, aha, we found the source of the pain. Of a positive result, what is a positive result with a diagnostic injection? Some say 50%. Some studies show that a patient should have 80% pain relief to actually positive result. And insurance companies are different as to what they need to see to approve a subsequent radiofrequency ablation. Some require 80% pain relief on 2 separate medial branch block injections. So it varies across the board. A medial branch block may provide pain relief for 3 months on average. Okay, so it's not just diagnostic, it's also therapeutic. And when pain relief wears off, you can either repeat the medial branch block and get hopefully the exact same result, a few months, or you can move on to a radiofrequency ablation. So radiofrequency ablation is also called radiofrequency neurotomy, medial branch neurotomy, radiofrequency denervation, lesioning, so on and so forth. They're all the same thing. 5 facts about the treatment. The current used is actually the same wavelength as radio signals, but there's no FM radio involved in the procedure unless there just happens to be one playing in the room. It can actually be more painful after the procedure than it can before. That will get better, but you may end up having some muscle spasms and some issues for a little bit. The pain relief from an RFA may last for 6 months, upwards of 2 years. Okay? You definitely need the diagnostic injection prior, as mentioned, the medial branch block or the facet injection. And it's been revolutionary. It's been one of the top 3 pain management revolutionary procedures over the last decade. What exactly does a radiofrequency ablation do? Well, what you see here is a facet joint. Okay, up here is a nerve root coming out. And as you can see, a medial branch comes off. This is called medial branch nerves. And supplies sensation to that joint. If you look at this joint below, all right, you can actually see there's a medial branch coming down and this medial branch is coming up. So what the radiofrequency does is it actually deadens those nerve endings here and here. It doesn't affect the nerve root, just the nerve endings. The procedure can be done now with the latest ones. You can do multiple levels at one time. You can see here you have 4 catheters in at the same time. And what you do is the pain doctor will stimulate these nerves a little bit at first to see if the leg jumps or whatnot. That means it's too close to a nerve root, and they'll readjust the placement. So usually when you after you do the stimulation to make sure it's not near a nerve root, the pain doctor will heat it up to 80 degrees Celsius for about 90 seconds, okay? And it deadens those medial branches. It's an outpatient procedure. It takes under an hour. What are the results? Well, the pain relief can last anywhere from 6 months to 2 years. It's definitely significant and longer lasting pain relief compared to steroid injections. Gives a greater range of motion, leads to lower use of pain medications, and a shorter recovery time. Complications, there could be a potential increase in pain for a week or so due to spasms. May have increased pain for months if the nerve is only partially deadened. Can have some numbness of the skin over the procedure site. This is usually transient. Very rare, you can have spinal cord trauma. The average pain relief in one study was 472 days. All right, so think about that. It's well over a year. It's about 15 months, okay? And there was another study looking at repeating the procedure to see what the results would be, and they actually got the same benefit of pain relief. The top pain management clinics in Colorado is Colorado Pain. They have several locations in the metro Denver area. Over 50 insurances are accepted by the board-certified, award-winning pain doctors. The number to call for treatment is 720-306-9575, and visit us on the web at painmanagementdenverco.com. I'm Dr. David Green with the Colorado Pain Network. Your pain stops here.